cough, and suddenly, there it is, red, mixed with spit. Your heart skips, your mind races. Is this serious, or just a scratch inside the throat? Coughing up blood is one of the most frightening symptoms a person can experience. Even a few streaks can make you panic, and honestly, it should never be ignored. Today, let's talk calmly, clearly, and truthfully about coughing up blood, what doctors call haemoptysis, and why your body might be sending you this warning. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. What does coughing up blood really mean? Coughing up blood means the blood is coming from somewhere inside the lungs or airways, not from the stomach, not from the mouth, and not from the nose. Sometimes it's just a few streaks mixed with phlegm. Sometimes it's more, and that becomes an emergency. The amount matters, but the cause matters even more. Even a small amount, if unexplained, deserves medical attention. How the lungs and airways work. When you breathe in, air travels through the nose, down the throat, into the windpipe, called the trachea. The trachea splits into two large tubes, one for each lung. These tubes keep branching, like an upside-down tree, into smaller and smaller airways. At the very end are tiny air sacs called alveoli. This is where oxygen enters your blood, and where carbon dioxide leaves. These structures are delicate, rich in blood supply, and when something irritates, infects, inflames, or damages them, bleeding can happen. Common and less serious causes. Let's imagine someone with a bad chest infection. They've been coughing for days. Their throat hurts. They feel feverish and exhausted. One morning, they cough and notice blood-streaked mucus. Infections like bronchitis or pneumonia are actually the most common causes of mild haemoptysis. The lining of the airways becomes inflamed and fragile. Tiny blood vessels can break during forceful coughing. The reassuring part? When the infection clears, the bleeding usually stops. When it can signal something serious. Now imagine a different scenario. A person who feels otherwise fine, but keeps noticing blood in their sputum. No fever, no cold, just blood that keeps coming back. This is when doctors become cautious. Lung cancer can sometimes present this way, especially in people over 50 or those with a history of smoking. Coughing up blood may appear before pain, weight loss, or breathlessness. This does not mean blood equals cancer, but it does mean blood should never be ignored. Chronic lung conditions. Some people live with a long-standing productive cough, bringing up large amounts of sputum every day. Over time, their airways become widened and damaged, a condition called bronchiectasis. These abnormal airways are prone to repeated infections and bleeding. Most of the time, the blood is small in amount, but occasionally, it can be heavy and sudden. Sudden and dangerous causes. Picture someone who suddenly develops sharp chest pain, severe breathlessness, and then coughs up blood. This could be a pulmonary embolism, a blood clot blocking the lungs' blood supply. This is a life-threatening emergency and needs immediate medical care. Heart failure can also cause blood-stained, frothy sputum due to fluid buildup in the lungs. Rare but important conditions. There are also rare immune and inflammatory diseases where the body attacks lung tissue itself. These conditions are uncommon, but when present, coughing up blood is often accompanied by other warning signs like joint pain, kidney problems, rashes, or severe fatigue. When no cause is found. Surprisingly, in some people, even after tests, no cause is identified. This is called idiopathic haemoptysis. It may be due to a tiny blood vessel bursting, similar to a nosebleed inside the lung, but this diagnosis is made only after serious causes are ruled out. What you should do. No confusion here. If you cough up a large amount of blood or bleeding does not stop, call emergency services immediately. If you cough up even a small amount of blood and don't know why, see a doctor as soon as possible. Do not wait. Do not self-diagnose. Do not assume it's nothing. How doctors find the cause. Your doctor will first confirm where the blood is coming from: lungs, stomach, or nose. Then, depending on your symptoms, they may order chest x-rays, CT scans, blood tests, or a bronchoscopy, a camera test that looks directly inside the airways. Each step is about ruling out danger and protecting your future health. The big takeaway. Coughing up blood is not a diagnosis. It's a signal. Sometimes it's minor and temporary. Sometimes it's your body asking for urgent attention. Listening early can save lives. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.